Hi, everyone. My name is Ericka Herzet, and I chose to guide my research project on social isolation and the impact on the overall brain health in older adults. So, a little background on why I decided to do this research topic is I am an LPN that works in a nursing home, and with the COVID-19 pandemic, we really saw an impact on the social isolation for the residents, not being able to see their loved ones, being socially isolated into their rooms, and truly their only contact was with the staff working there. So that was one of the big reasons why I chose this topic for my research. So the COVID-19 pandemic is one of the main contributors to the recent elevation in social isolation. I wanted to look to see if there was some more research prior to the COVID-19 pandemic, as right now we're still in the pandemic and research is still evolving on actually the impact of the COVID-19 isolation on brain health. But the prevalence of social isolation increased 6.7% just during the pandemic. So I was able to find some studies that help support my research prior to COVID. So I developed a PICO question to help guide my research. In older adults over the age of 65, does social isolation have an impact on their overall brain health compared to those who are not socially isolated? So some background on that. I was able to define brain health into some subcategories. So when saying brain health, we can use that as a broad umbrella term. And under that, the categories could be cognition, depression, mental health, dementia, and Alzheimer's. And then the definition I went with social isolation was the lack of social contact and having few interactions with people on a regular basis. So that 1/3 of adults age 45 and older feel lonely, and nearly 1/4 of adults age 65 and older are considered to be socially isolated. They consider loneliness is more dangerous than obesity and is as damaging to your health as smoking 15 cigarettes a day. Social isolation was associated with about 50% of an increased risk of dementia and other serious medical conditions. Also, the thing with social isolation is you're not always going to know the effects like right away. So, if you think of smoking or other types of things that you do, you might not see those effects till later in life. So, with social isolation, especially with the COVID pandemic, we might not see some of those effects maybe a year, a couple years, or even many years later. It's going to be very interesting to see our age group and either in other generations what their numbers of dementia and Alzheimer's will be like since we lived through a COVID pandemic. So I was able to find 3 literatures that I used to help me with my research. All 3 were all articles where they gathered baseline data. So they would do certain types of scores on cognition, like BIM scores and that and such. And they would also do a follow-up interview about 2 years. And even one of the research articles did a follow-up wave in 4 years. So they would get the baseline information on people's cognition and brain health and then do a follow-up. And they could see that there was an association between those who were lonely and isolated, and then that they had poor cognitive functioning. All 3 supported my PICO question, and there were also some other variables that they had taken into consideration in some of the articles that helped them prove that social isolation does affect their overall brain health. So for QSIN is known as Quality and Safety Education for Nurses, and it developed competencies to help educate and prepare future nurses to improve quality and safety. So they have 6 core competencies. They have patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So I think with my topic, I could have used quite a few of the competencies, but I narrowed it down to the 2 most that I felt were most fitting. So patient-centered care, I feel like fits into my research topic, as we're focusing on one person at this time and how social isolation affects them. You want to focus on them rather than the task, just getting their task done every day. Focus on what makes them them. Seeing the patient through their eyes rather than your eyes. So especially with social isolation, you don't know what's going on with them and you don't know what they're thinking. So trying to put yourself in their shoes and think about how they're going through this and how they're experiencing it. And advocate for their decisions. If you think about some of my research topic was specific with older adults. I think sometimes older adults just get pushed under the rug, or they might not understand what's going on, and so they just agree with it. So really advocating for your patients and making sure that maybe families are advocating for them to be placed somewhere where they can have some social interaction and they're not just so isolated at home. I also chose teamwork and collaboration. So working and collaborating as a team is essential. So just using everybody in the nursing, social work, doctors, case management, all those to work and help provide the best fit for patients who are socially isolated. Just keeping the open communication and then collaborating with family, and then just working together for early recognition of social isolation. And maybe you're able to notice it early and can help provide some interventions early to help decrease their worsening cognition. So then for recommendations, I with both of my, or all three of my literature reviews, it recommended that implementing interventions to help prevent social isolation or ways to improve social isolation is key. One of the research articles went into educational level, which was very interesting. And they were able to separate the participants into different educational level groups and seeing if their social isolation worsening was different from those with a higher educational level. So that was one of my recommendations, was if there's further research that they should maybe separate the participants into different educational levels to see if there's a correlation with that. And then also with the COVID-19 pandemic, there's not a lot of research. So that's definitely a recommendation of mine, was to seeing how if technology being used during those moments of social isolation that they couldn't be prevented because of maybe they had COVID or they have a disease that they don't want to, they're immunocompromised or such. If maybe technology helped interact with loved ones or support groups, if that helped decrease the effects of social isolation on their brain health. Because before the COVID-19 pandemic, all three of my literature reviews were prior to that. So there was no interaction with technology. So that was something that I recommended something we could look into. So my conclusion of my research is that furthering research into finding beneficial and acceptable interventions to prevent social isolation and encourage social interaction is vital. Social isolation has been proven to have worsening effects on one's overall brain health. So I think that just noticing if your loved ones or anyone in your family is being social isolated, try your best to find ways to interact with them or find ways that can help get them out and get them interacting in the community, and maybe will help lessen those effects of worsening cognition. Thank you.